Assalamualaikum warahmatullahi wabarakatuh, and a very good day, everyone. So this is the second part of our previous topic, which is the lung disease and dysfunction. And it's going to be the last asynchronous teaching and learning. And please do fill up the questionnaire after you have finished watching and answer all the questions in the video. And for today, I'm going to explain how exercise training and how to prescribe exercise training for both COPD and asthma patient, and how exercise can improve their daily living and to reduce the exercise-induced asthma or exercise-induced blockage or bronchoconstriction. So exercise training for COPD. So the main goal of this, the main goal of exercise for COPD patient, let me just enlarge this first, okay, is to reduce symptoms. So all the symptoms I explained earlier can be improved when you perform a regular exercise, appropriate exercise training that is suitable for COPD patient. And this is also to improve the ability to undertake daily activities and to increase the patient independence. So basically, there's three types of training that need to be incorporated, which are the lower limb training, both endurance and resistance exercise. You can apply both endurance and also weight training for the patient. And the second one is, I would say, the most important type of training that you must incorporate to your COPD patient, which is the upper limb training. Okay, both endurance and resistance as well. You can apply these two, and I will explain why upper limb training is the most important for COPD patient. And then last but not least, the training of the patient's inspiratory muscles. Okay. And for that, we can use many modes of exercise training, which are cycling, walking, stair climbing. You can use that mainly, to improve the aerobic activity. Hence, also to improve the cardiopulmonary system, improvement in cardiopulmonary system, and at the same time will improve, the strength and endurance of the related muscles that involved in respiration. And limb resistance training must involve muscle group around the shoulder, girdle, and leg extensor and flexor. So this is why the reason you must focus on the upper part of the body around the shoulder, okay, around the shoulder girdle, and of course the leg extensor flexor. Okay, the upper part means you must focus on the upper part. That's because you are focusing or trying to improve the functionality of your respiratory muscles and those assistance muscles that assist the forced breathing. So that's the reason. Whilst for lower limb or peripheral muscles, meaning that muscles that are away from your respiratory system, is because of the system that developed among COPD patient, where the deterioration of the external or peripheral muscles that often happen among this patient. Okay, atrophy that happens. So that's why you have to also not to forget the peripheral muscles, but the main focus should be on the upper part of the body, near the your upper thoracic part of your body, to improve the efficiency of breathing, so that you don't have to rely on other medication, and also be much more independent. And training can be done for 2 to 3 times per week. So these are the outcome measures of the performance so that you can monitor during the exercise. Incremental exercise testing can be used, okay, or GXT, graded exercise testing, or incremental exercise testing can be used, and to limit to the limit of the tolerance, meaning that you can use a gradual increment of the intensity just to initially mark which parts, okay, at which level of intensity that the particular patient can tolerate before the symptoms develop, okay, and then you can mark that, you can mark on that, and start the training gradually, so you can shift the tolerance level away, okay, from the initial level, okay, and then fixed intensity at the limit tolerance and time walk test. Okay, this is meant by towards as time goes by, you have to focus on training within the tolerant limit. So in a way, you can shift it a bit farther. Okay, the limit tolerance could be due to dyspnea. Okay, you can tell based on their dyspnea, or because you can also mark that due from the lactate threshold as well. Okay, focus on that, because if I've explained earlier that those who are infected with COPD might have an earlier stage or earlier lactate threshold because of inefficiency to get rid of the acid. Okay, the acid acid buffer system is not as efficient as the normal people, so they might have an earlier stage of lactate threshold. So that's the way you can focus on them to train within this level, so that it can shift away the lactate threshold and make them much more functional. Okay, then okay, and then 6 minutes of walk test. Okay, this is one of the, if you don't have a sophisticated machine or devices to measure GXT, scientists has also come up with alternative and much more applicable type of training and testing that you can apply to your clients, which is the 6 minutes walk test, and it has been shown to have a high validity as well. This is where you can test your client that when you ask the client to walk for 6 minutes, okay, so the client must, or the patient must reach at least a minimum of 54 meters. That's the like the benchmark. So make sure you train your patient until the person can reach more than 54 meters minimum if the person walk for 6 minutes under a standard a flat terrain. Okay, or simply you can find if you can do it on the treadmill as well. If you cannot find treadmill, make sure you find a flat terrain, not too hilly or not too no inclination, so the person must reach at least 4 meters. So that's the indicator that you can monitor to your client as well if you don't have any sophisticated machine or devices to monitor. So this is the underlying mechanism for improvement in exercise tolerance, and it can be divided into two groups. The first one, so mechanism changes due to the influence of training. Of course, the training, like normal people do, okay, certain level of training will make change to certain physiological in your body. We alter that, and the second one, change derived from a disease-specific improvement, okay, in mechanical ventilation. For example, muscle force improve, okay, muscle force of the person's respiratory system, helping to assist an efficient inhale and exhale. oxidative capacity, meaning that get rid of all the substance that can promote that can elicit or induce asthma or bronchoconstriction, okay, inflammation in bronchus, so those sort of changes, adaptability to get rid of the inflammation, okay, these kind of changes, and then also last but not least, the lactate threshold or acid buffer system in the body. Okay, so these are the two group or two category of changes, underlying mechanism that can improve the quality of life among COPD patient. And as you know, COPD has no treatment. Okay, there's no specific treatment to heal the disease. It's just that you can only improve their daily living. Okay, by doing exercise, they can improve reduce the symptom, at the same time improve their daily living. So this is the exercise training for asthma, and the purpose of training of asthma is not the same as COPD, because there are totally different totally different pathophysiology. Okay, but strong evidence have shown that exercise can help asthma in certain ways, especially in reducing the bronchoconstriction, okay, reduce the inflammation of the bronchus, and lots of things. However, there's no evidence that shows exercise can improve lung function. Okay, so lung function should be, actually is the same. So this is same goes with other, because asthma patient has quite fairly similar lung function compared to normal population. It's just that there are airways, bronchus and bronchioles, that have a problem, that oftenly inflame because of certain exacerbating factor or triggering factor or allergens that can lead to reduce the lumen of the airways, decrease the lumen of the airways. So as I mentioned, frequent exercise will also benefit upon the exercise-induced asthma, will reduce the exercise-induced asthma, and it also not just exercise-induced asthma, but also atopic allergy that can trigger asthma. Okay, so there's two reasons that can lead to asthma attack, which are the exercise itself can lead to asthma. Okay, leads to asthma attack. That will be because of when a person do exercise, usually prolonged and under the dry environment. Okay, less humid and dry environment. Okay, so when the airway is dry, that could lead to the inflammation of the bronchus or the airways. Okay, bronchoconstriction will happen. It will trigger and dilate it, and then it will lead to asthma attack. Okay, and whilst for allergic, there are certain substance that can induce asthma attacks. Okay, some chemicals or debris, could be pollen from flowers, that could also be the triggering factor that could lead to asthma attack. Okay, so these are the two factors that can make someone's got attacks, asthma attack. Okay, and by doing a frequent exercise, actually can help the airways, okay, or the bronchus, to adapt with the inflammation happen, and by due time it will quickly not easily get irritated. However, scientists have shown that the effect is pretty much individual. So yeah, you have to, for that you have to, put the principle of individuality or specificity to your asthma or asthma patient, in increase the training overload, okay, and to see changes. There's two, I would say more, I mean three main model of okay, I should correct this. Okay. Three main model of aerobic exercise training. Three main model of aerobic exercise training for asthma. Okay, I will explain why aerobic exercise is the best way to improve asthma patient asthma patients from getting attacked by asthma. Okay. The first one is swimming, running, and the second one is running and then cycling. And the rationale of swimming is because of the warm, humid surrounding will create less asthmogenic environment. So, as I mentioned earlier, the thing that trigger asthma attack is because of the dry airways of your respiratory system that can, make the airways inflame and reduce the size of the lumen. But by doing exercise, swimming in the swimming pool, or in the by doing swimming as the mode of the exercise, definitely the surrounding is more humid. Okay, it will create less. That's what it means by it create less of asthmogenic environment. However, there are certain concern that you have to take care of, because chlorinated water can also damage the lung, because it can be as well act as the elegance to certain people, and also not everyone can perform swimming. Swimming requires quite skills, certain specific skills. Not everyone can perform, so there's also a limitation on that. So yeah. So therefore, you should come up with other alternative aerobic training, which are the circuit training, circuit, gymnastic. Also, you can ask them to involve in any competitive sports, okay, team sports. So the moderate exercise training, 60 to 70%, could be up to 80%. That's already intense. I would say 60 to 70% is the best, intensity level of intensity for you to prescribe exercise to your asthma client, because studies have shown that within this moderate intensity, there's no exercise induced asthma has been found. Okay, this is especially if you want to prescribe exercise to those who have high severity of getting asthma attack. Okay. So these are the training response that you can assess. Okay. Tools that you can use to assess the progress and prescribe the training intensity. You can use VO2 max and VO2 peak. Okay, since asthma patient usually doesn't have any contraindication to high intensity exercise. They might have got into asthma at high intensity, but that's only happen if the high intensity is prolonged, and if the lumen or the airways is inflamed. That's usually due to the dry air and also prolonged kind or type of exercise. But usually there are kind of a tolerable to high intensity exercise. But you can always make sure, take precaution by preparing them with the inhaler during the assessment. Okay, just in case if anything bad happen. And 6-meter run test. This is kind of a modified from the COPD 6-meter walking test. You can use that as well. There's a standard norm for you to monitor the progress of your client. Okay, 6-meter run, and you will get a certain distance, and the person have to achieve a certain distance in order to categorize as the at least good. Okay, in adapting to that particular exercise demand. Then heart rate, blood lactate concentration, and then ventilatory response using the spirometer. So you can monitor the tidal volume, okay, under the graded exercise testing, okay, when you ask the perform to do 2 stages of intensity. At the same time, you also measure the ventilatory response using spirometer. So you kind of measure the tidal volume, okay, residual volume. Okay, you learn this in anatomy and physiology. So you look into the volume of air that inhaled and exhaled. Okay, the tidal volume pattern. Okay, respiratory rate, those sort of things. Okay, the sort of variables that you can monitor to see progress and their how tolerate they are at different stage of exercise intensity. Okay, and same like COPD, focus on that particular region that the person's threshold, so that you can shift away to.
Nanti ada orang call.
Okay. Yeah, so better. Okay. And okay, there's evidence that shows exercise induce bronchoconstriction among elite athletes compared to general population. So I want to answer this. Why is this happen? Okay, why elite athletes have higher tendency to get asthma compared to general population, especially elite athletes that involved with marathon and endurance running, endurance events, any endurance event. Okay, I've already explained this earlier. I hope you can answer that. So these are the principle for exercise for pulmonary rehabilitation in general for both COPD and asthma. So the principle of overload, specificity, and reversibility can be applied. So this is kind of a recap what I have explained earlier. So you have to sustain aerobic training for 20 to 30 minutes. Okay, prolong. This is especially for COPD patients, since they have a lower tolerability. Okay, tolerance or lower tolerance on exercise because of their muscles. Deteriorating of their muscles or atrophy of their muscles. So they have difficulty in maintaining certain duration or prolonged duration of muscle contraction. So you have to apply endurance exercise in general in between of 20 to 30 minutes. Okay, to see to help them out with improve their functionality of their muscles. And if the patient feel any difficulty, okay, due to acidemia, because of acidity, because of lactate threshold or hyperinflation of the airways, or shortness of breath, or dyspnea, okay, you can opt to do an interval training, shorter the duration, make it less than 20 minutes, for example, but do high intense exercise with interval of 30 seconds of active recovery, okay, which scientists have shown it will produce or it will yield similar benefit like sustained prolong. Of course, sustained prolong is the best option because you kind of um, train the muscles to contract continuously, okay, rather than intervally. So this is the best one. But if you cannot, if the persons cannot feel difficult or cannot adapt with the demand of the exercise, you can always use the interval training. And also play around with the interval. Okay? Play around with the interval, 30 seconds, 30 minutes, between 70 to 100% high intensity to 60 to 80% moderate intensity. Play that around in overloading or progressing the training program from 1 week to another. You can play around with that. And improvement can be seen with longer training. Of course, the longer you do, the longer if the patient engage with that particular training program, and if there is appropriate overload principle, of course you're going to see it progress as early as in the 3rd month. And then specificity, okay, focus on the upper muscle body for COPD patient. And of course, reversibility, you have to tell the patient that if you don't do, if you stop doing the exercise, we're going to be back to square one. So keep on encouraging them to do exercise and improve their functionality and daily living. So for that, that's everything for this topic. Thank you.